Hello everyone. So in this video, I'm going to be talking about the coxal bone, which is right here. It's also known as the hip bone. As you can see, this demonstrates the lateral and medial view of the right hip bone. The hip bone does serve as the attachment point for each of our lower limbs. The hip bone or coxal bone forms the pelvic girdle portion of the pelvis. The paired hip bones are the large curved bones that form the lateral and anterior aspects of the pelvis. Each coxal bone is formed by three different bones that fuse at the acetibulum, which is located right here. And those three bones are the ilium, the ischium, and the pubis. So the ilium forms the superior region of the coxal bone. It is the largest part of the hip bone. Then we have the ischium, located down here, which forms the posterior-inferior region of the coxal bone. This part of the hip bone supports the body when one is sitting. Then the pubis forms the anterior region of the coxal bone. The pubis curves medially, where it joins to the pubis of the opposite hip bone, but at a specialized point known as the pubic symphysis, located down here. This curved superior margin up here is known as the iliac crest. Then the rounded anterior termination of the iliac crest is the anterior superior iliac spine, right here. And then right below that is the anterior inferior iliac spine. Both of these iliac spines do serve as attachment points for muscles of the thigh. Posteriorly, the iliac crest curves downward to terminate as the posterior superior iliac spine, which is located right over here. And right below that, we have the posterior inferior iliac spine. Then this is located at the inferior end of a large roughened area, which is known as the auricular surface of the ilium, which is over here. Then we have the iliac fossa, which is right over here. This shallow depression located on the anterior medial surface is of the upper ilium. Then we have the ischial tuberosity. It's a large roughened area of the inferior ischium, which is right down here. Then we have a slightly curved posterior margin of the ischium, which is above the ischial tuberosity, known as the sciatic notch. Then we have the bony projection separating the greater sciatic notch, which is the ischial spine, right over here. The pubis forms the anterior portion of the hip bone. Then located superiorly on the pubic body is a small bump known as the pubic tubercle, which is located right over here. Then the acetibulum is a cup-shaped opening right over here. It's on both sides. It's located on each side of the pelvic girdle that's formed, where the ischium, ilium, and pubis all meet together, and into which the head of the femur inserts. Then we have the obturator foramen, which is the large opening created by the ischium and pubis bones of the pelvis, through which nerves and blood vessels pass, which is this white area right over here. Then the upper part of the ilium is the iliac wing, right over here. The iliac wing is considered to be the surface that expands from the acetibulum. The iliac wing consists of internal and external surface separated by the iliac crest superiorly, which is known as the gluteal surface, which is right over here.